hopefm.org to book your session. Hope Recording Studios, giving life to sound.
It's coming up to 26 minutes to 8 o'clock. You're listening to Breath of Heaven on Hope FM. Listen and leave. It's Thursday's edition of the program. And as I promised you earlier on, we're going to have an insightful conversation revolving around joint stiffness. And I welcome you to send your question. If you have a question or a concern, you can do so on our SMS line to 0933, on WhatsApp 0717 400 555, across our social media platforms at Hope FM Live on Facebook as well as on X. Tonight, I have the honor and privilege of hosting a doctor who is an orthopedic surgeon from AIC Cure International. Dr. Jeremiah Nangale is with us tonight. Welcome, Daktari, to the studio.
Thank you, Jackton. It is a pleasure to be here.
Yes.
Yes.
Could be your first time here on Breath of Heaven?
Oh, yeah, this is the first time to be here.
All right.
Yeah.
How does it feel?
I think it feels good.
Mm-hmm.
Yeah. So looking forward to the conversation that you're going to have.
Mm-hmm.
Yeah.
All right.
Yes.
And so tonight we are going to look into this whole issue of joint stiffness, get to find out what it's all about. And I know this is one area that would resonate with many, and feel free to interact with us as well. And so let's start from the very beginning. Somebody would like to have an understanding of the types of joint stiffness that are there, and you can elaborate on that as we begin.
Okay, thank you.
Mm-hmm.
So before I go to the types of joint stiffness, it's first of all important to understand what joint stiffness is. So all joints usually have what we call a particular range of motion. So each joint has its own range of motion. Like we could say the elbow is about 30 to 135 degrees. The knee is about 0 to 125 degrees. So when you lose part or whole of that motion, then we say you're experiencing joint stiffness. It could be associated with pain or no pain at all. Okay. So now when we want to talk about the causes of joint stiffness, we want to give them a broad classification so that we can understand better what this joint stiffness is. So you can have causes that are local and global. Now, on the local causes, you can have things like infections. So anything that will infect the joint, for example, if you have a bacterial infection or a virus or even a fungal infection, if that goes into the joint, then you can have a localized joint stiffness. That will present with pain. You could also have trauma. Trauma can come in two forms. Number one is the muscles or the ligaments or the tendons around that joint can cause stiffness if you injure them. So people would like to call it as a sprain or a strain. Okay. So what happens is that the muscles, the body, when the body is injured, the muscles around the joint, they undergo what we call spasm. Okay. So they contract. That is to protect the joint. So you can have stiffness from that. Also, if you have a fracture, most of the time fractures that occur around the joint and go into the joint, those fractures can cause stiffness. Okay. So that is one way to classify it. So the other way is global stiffness. This can be caused by things like autoimmune diseases. Okay. You can have rheumatoid arthritis, you can have lupus, and then you can also have things like gout. Okay. That's when the body is unable to remove things like uric acid. Okay. I think it's a common thing. You hear somebody has a lot of uric acid in the blood, and then that uric acid, because the body is unable to remove it, it gets deposited in the joints. So what happens is the body thinks it is an enemy. So then it sends out its soldiers, and then they react in the joint, and then it becomes stiff and it gets swollen. Yeah. So then the other thing you can have is, which can be local or global, would be something like osteoarthritis, which comes as we age. The more we use our joints, the more they wear and degrade. Okay. So I think that's how we can classify it. Maybe just to add a last one would be, if you're lying in bed for a long time, and you're not moving your joints, then that could also cause joint stiffness. Yeah.
And at what times are people more prone to joint stiffness? Is it morning, noontime, or evening? What are the times that really present this kind of stiffness?
So the stiffness
Mm.
can depend on the type of disease that you have or what is causing the stiffness. Okay. Diseases such as autoimmune diseases like rheumatoid arthritis, the stiffness usually comes mostly in the morning when you wake up. You especially the hands, the fingers, they become stiff. But as time goes, as the day progresses, the stiffness wears off. Things like trauma, if there's swelling around the joint, what happens is the stiffness is usually due in the evening when you have rested. Once you become inactive, then the joints start to become stiff. Yeah.
And so when is it now considered serious? Because somebody may present with these symptoms of stiffness in the morning as they wake up and all. When is it considered serious that they would now need medical intervention?
Okay. So then one of the things is if the pain persists. Number one, the number one thing you need to think about is the stiffness is out of proportion. It's something you're not used to. Okay. Number two is if it's associated with pain. Okay. Then the other thing you need to think about, if you're having any other symptoms on the body like fever that you didn't have before, that you think are associated with the stiffness. The other thing I've mentioned is if it's prolonged. When you have those symptoms, then it's better you go seek healthcare. You go see a doctor and see what the problem is. Yes.
All right.
Yeah.
And so when it comes to lifestyle and what you'd call maybe intervention, does exercise help in alleviating the stiffness, or does it have any dangers whenever somebody would present with joint stiffness?
All right. So in orthopedics, our biggest friend is physiotherapy, which is usually the backbone of our treatment. Now, in physiotherapy, what they focus on is motion across the joint. Okay. If the stiffness is not caused by trauma or a fracture, then motion across a joint is your friend. So you want to keep moving. So the exercise helps you a lot, because you also realize that across a joint are muscles and tendons. Okay, those are the ones that help move the joint, and you also have the bone that forms a joint. So what happens when you exercise more? You strengthen the muscles and you strengthen these bones. Okay, and those are the ones that cause the motion. So if you do the right amount of exercise, okay, then your joint motion will be better and the stiffness will be alleviated. But however, there are few instances, like I've said, that will want you to restrict motion when you have stiffness. Okay. You give your body some rest, and then especially if there's pain, once the pain is gone, then you can continue with exercise. Yes.
Now, someone presenting to you in your practice, as you have said, orthopedics, and has these symptoms that seem not to be going away. Somebody has tried over the counter, the painkillers and all. What would you do to them in order for you to treat them when they come to you in such a state?
All right. So the first thing you need to do is we usually take a history. So I would like to hear your story. I want to know exactly what is happening to your joint. Okay, when did this pain start? What caused it to start? What makes it worse? What makes it better? What time of the day does the pain, does the stiffness occur? Is it in the morning or is it in the evening? Okay, because that gives you a particular direction of where you think the stiffness is coming from. Okay, then from there, you also need to look at other factors. Okay, you need to ask about the family history, because some of these things you might find they're common in the family. Okay, there's some stiffness that is usually congenital. You're born with it. Okay, so you might pick it from the history. As you're asking the story, they might tell you, I have a relative who also has the same thing. So that guides how you're going to manage. Then once you have the history, then you need to have a look at the patient. You need to see. So you have a look at the joint. You feel whether it's hot. Is it tender? How is the motion? Is it excessive, or is it just normal? Okay. Then once you've done that, you'll have an idea of what's going on with that joint. Okay. Then from there now, depending on what you think, you can now decide to do what you call imaging. Is it an ultrasound? Because you might find the joint is swollen. You want to know what is inside that knee. Okay, so you want to do maybe an ultrasound, or you want to do an X-ray, or even you want to do a CT scan if you think if the X-ray is okay. For example, if you come to Cure, we'll do an X-ray. Once we think you need further imaging, we'll do a CT scan and an MRI. That will be able to now give us a good picture of what is happening in the joint. Then now from there, depending on what you find, then you can now find the management of that particular problem. Yes. Yep.
All right, moving on. In case you are joining us right now, we are talking about joint stiffness, and helping us to understand this is Dr. Jeremiah. And we are looking at an issue here with the age. When it comes to age, I think there has been an observation that as people age, there tends to be stiffness of joints and all. And so what can people do to slow down, especially as we age, to slow down stiffness as we get older?
Okay. So one of the things is you could start with the diet. We can start with the diet. Eat healthy. When I say eat healthy, I mean avoid processed or refined foods. Okay, because what happens in joint stiffness is inflammation in that particular joint. What causes inflammation are most of them is from the refined foods, because they produce some for lack of a better word, toxins, which you call like oxidants. Okay, so those ones create the reaction in there. They can cause the reaction in the joint, which can cause stiffness. The other thing is keep walking. All right, which means you need to exercise regularly. Okay, so that saves you a lot. And then on top of that, it's nice to know, when I say exercise, it's nice to know how to exercise. Okay, not all exercises are good for the joints, so you need to do it in moderation. It would be nice to have a physiotherapist or a trained person show you how to exercise, because you might go in the gym and then do exercise across the joints and actually end up harming the joints. Because the other thing with the joints is that the more you use them, especially if you don't use them well, the faster they degrade. Okay, and then you get something like osteoarthritis, because it comes as about of wear and tear. Okay, so you need to know how to use a joint. Okay, so we've talked about diet, then we've talked about exercise. The other thing is you need to have early healthcare seeking behavior.
Mm.
Once you feel something is wrong, don't sit with it because it might be something big. So you need to go see a specialist, an orthopedic surgeon, so that we can be able to tell you, I think this is okay, or I think we need to do something. We just give you the right direction to take.
Mhm.
Yeah.
Doctor, if somebody would ask probably specific food that you would you would suggest for someone, you've said we avoid processed food, probably just mention a few of these food stuff that now somebody would concentrate on in order to improve the bone quality.
Okay.
Mhm.
So for the bone, we'll start with for the bone quality.
Yes.
You need to eat foods that are high in calcium. Okay. But usually the most important thing for the health of the body and the joints is vitamins. Okay. So you need to eat a lot of fruits. You need to eat a lot of vegetables. They usually talk about, you could divide your plate into 3 parts, where you have a lot of vegetables and fruits, then you have a little starch, and then you'll have a little protein. Okay. But the focus is on the vitamins you get from the vegetables and the fruits, because they act as antioxidants, and those are the ones that reduce the inflammation in the body. Yeah.
All right. And I'll need to take you back to the treatment options and all. When somebody goes through the process, comes to your practice and has received the attention that they need, they've given their history and all, and I would like to find out, in your practice, what are some of the what you'd call interventions that would be non-surgical, and that which would go to the extent of now you intervening surgically?
Okay.
Yes.
So for the non-surgical ones, number one, if it's caused by, let's say, trauma that is not a fracture, we would begin with we would immobilize. We would stop you from moving that joint. Okay. We would give you some painkillers so that we release that spasm across that joint for some time, maybe about 2 weeks, and then you can go home, put some ice on that joint. You also need to elevate the part particular, if it's a leg, if it's a knee, if it's an ankle, you lift it up. Because there's some swelling that goes on around the joint. So you want the swelling, the fluid that is in that joint, to go back to the heart, so that that inflammation goes down. The other thing which I had said is very important is physiotherapy. Okay, if this is not trauma related, then physiotherapy would be your friend. Okay, so we'll send you to a physiotherapist, and then they would start the physiotherapy, and they would advise you on the type of range of motion that you need. The other important thing is to empower patients. So then we would give you what we call a home exercise program. So that way you don't have to, especially if you're not staying around Kijabe, or you have some financial constraints, then you're able to do the exercise alone at home using that home exercise program. Then you can come back later. We see whether you're doing it correctly and how you're doing it. Okay. So now if that fails, we would then think of surgical options. Okay. We would like to know what's happening in that joint, because if it is a fracture, if it's a fracture that has extended into the joint, the number one thing is to bring back the anatomy of the joint. Okay. If there are particles that are displaced, bone fragments in the joint, we want to remove them, and we want to make sure that the lining of the joint comes back to almost perfect, because that is what will bring back the motion. Okay. The other thing is that causes stiffness is, we call it fibrous tissue, because of the inflammation. The body sends its inflammatory tissues, which you can simply call like soldiers, and then they form fibrous tissue within that joint. So we will go in and remove the fibrous tissue in the joint, okay, and then start moving the joint. Before we even do that, we could try and move the joint. So we sedate you so that you do not feel the pain, okay? Because sometimes if you try and move a joint when somebody's awake, they will tense their muscles. So once we sedate you, you're out of pain, we relax your muscles, then we can move the joints in theater, okay? And then afterwards, once we've achieved the range of motion that we want, you can continue with the exercise by yourself at home, okay? Now, for the removal of the fibrous tissue, we can do it either by keyhole surgery, which is using a arthroscopic, or we can open and look inside to see what is causing, okay? There's something else. Now, on the other end, if you have osteoarthritis, and we have tried all the non-operative measures like I've talked about, then we would need to replace the joint, okay? Especially the big joints, we would need to replace them. I think there was one thing that I didn't talk about is obesity. It's also a big factor that contributes to joint stiffness, okay? It could be the muscles or the tissues between the joint that could prevent you from moving the joint, or because of the weight of the body, that alone can cause that can accelerate the wear and tear across the joint, which usually forms the basis for low back pain in some patients, okay? Because now the body is unable to support the weight, especially at the low back. Then you have wear and tear along that part of the lower back. So then losing weight usually forms a key part of management for joint stiffness. Yes.
All right. We are learning, getting great insights from Dr. Jeremiah. He is an orthopedic surgeon from QA International, helping us to understand joint stiffness. You have a question, you have a comment, you have a concern regarding your bones, feel free to interact with us. Reach out to us via our SMS line 20933, on WhatsApp 0717 400 555, on Facebook, as well as on X at Hope FM Live. We're using the hashtag Thursday edition. At the top of the hour, Fresh with Benny, then our Artist of the Week segment, this week featuring music by Judy K, will follow thereafter. Then we continue with this conversation in the next hour.
Hi, this is Carol from the Celebration Choir.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcast?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcast?
Really? Even Mr. of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Mr. of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Mr. of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Mr. of the what?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah, I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
And that's great music by Judy K. She is our Artist of the Week here on Breath of Heaven. The song is titled Solid Rock, and that is Jesus Christ, the solid rock on which we stand. All other ground is sinking sand. Welcome to the second hour of the program, and tonight I'm hosting Dr. Jeremiah, and he is an orthopedic surgeon from AIC International in Kijabe, helping us to understand joint stiffness. And in the first hour, we just covered a bit of that. And in case you have a question or a concern you'd like us to address, feel free to share. Our SMS line is 20933, on WhatsApp 0717 400 555. That is SMS line 20933, or on WhatsApp 0717 400 555. On Facebook as well as on X at Hope FM Live using the hashtag Thursday edition. I've seen your questions coming through, and so we'll be looking at them in a little while. So keep sending them. At around 8:30 thereabout, we'll look at those questions. But let's carry on with Dr. Just looking at this whole element of stiffness. We've covered matters to do with what it's all about, the various types, the intervention, the surgical and non-surgical, what you'd call interventions, and all that. And so I'd like us to look at the connection. I think you had mentioned a bit on that. I would like to have a better understanding the connection between joint stiffness and arthritis. Where is the joining point of these two conditions?
Okay. So for joint stiffness and arthritis, we could put it into two categories. The first category would be the one I talked about, like autoimmune disease. Okay, I'll talk about that, and then I'll talk about osteoarthritis. So in autoimmune disease, what happens is the body sends antibodies into into that joint, thinking it is a foreign object or material. So then what happens is the antibodies destroy the cartilage that lines the joint, and then you have wear and tear. That is usually associated with a lot of inflammation, which causes fibrosis, like we talked about. So once the fibrosis sets in, then the joint stops moving. Also, the cartilage is worn out. And the cartilage is what helps in the joint motion. You also have things like synovial fluid, which is the fluid that lubricates the joint. So then what happens in those autoimmune diseases, because of inflammation, you have excessive production of the fluid, the synovial fluid. So then the joint swells and it becomes tender. Once it's swollen and tense, you can't move it, okay? The other part is now the osteoarthritis, which comes as a result of wear and tear. So it's different among people. There are people who will get it at an early age. Others will get it later in advanced age. So there are people who are susceptible to getting arthritis. Others will not get. So what happens in osteoarthritis is basically wear and tear. Okay. So because you're moving the joints on top of each other. Okay. And as you age, the production of that fluid that helps to lubricate the joint reduces. So then you start having wear and tear. Then you have the arthritis. So the cartilage is usually gets worn out. Okay, once the cartilage is exposed, it starts getting worn out. It's like it creates what looks like a ripple effect. So that small lesion creates more lesions across that cartilage. So then you have osteoarthritis. The other thing that I had talked about is trauma. If you get a fracture that gets into the joint, okay, and due to one or more reasons, you're not able to align those the bones that were fractured in the joint, you create an inflammatory process that accelerates osteoarthritis. So patients who have or people who have fractures in the joints will get early. Most of the time, they'll get early onset osteoarthritis. Yes.
All right. Let's talk about workplace habits, probably sitting for long hours or repetitive movements. Do they contribute to joint stiffness?
Oh yes. So like I had said, we want you to keep moving. So they recommend that you move your joints between 60 to 90 minutes. So between those 60 to 90 minutes, you should at least try and move your joints. Otherwise, you'll get stiffness. Sometimes you're seated and you try to wake up, you feel like the joints are not moving. It's because you are keeping them stiff. Not immobile. Okay. So you want to keep the joints moving. Yes.
All right.
Then on top of that, because the back also has joints. So if you're talking about the workplace, the people who sit the most, like drivers and things like that, they have to attain a certain posture to protect the joints of the back, especially the lower back. Yes.
While at home, there are some simple exercises somebody may do in order to keep their joints flexible. Would you recommend some of these, what you would call stretches or routines at home?
Oh yes, I would. I would recommend some of those stretches. So the stretches keep the joints active, and they keep the muscles moving, because the muscles usually work by being moved. So if you don't move them, then they are the ones that keep the joint in motion. Okay. So if you don't move those, if you don't stretch those muscles, then you end up with stiffness. But the best way would be to have a physiotherapist give you what you can do while you're at home, because that is more professional. We could give you a paper that you could have at home. You could look at what you need to be doing, especially if you think you'll be immobile for a long time, or if you're in a plane and you need to move your joints, then you can have that before you, let's say, take a flight or something. Yes.
All right. All right. And so I'll just allow some few questions here because they are coming in their numbers so that we can at least highlight some of them. One here is from our listener who says, our mom has been bedridden for 1 year. She was paralyzed, waist down, but she now can feel the legs. She can now feel her legs. Can she regain mobility again? The spinal injury was because of tumors in the spine. And so the question, can she regain mobility? And she has just shared what the mom has been going through. Yeah.
Okay. Yeah. Sorry about that. So then she could start regaining. So we cannot absolutely say she will regain all the motion that she had. The other thing that we need to find out is how long she has been immobile, because it also tells you how much you need to do for you to regain the motion across that joint or the function. It's good that she's beginning to feel her limbs, because you being able to feel gives you power of over your own body. But the first thing that she needs to do is get a physiotherapist, okay? Because initially the joints are quite stiff. She won't be able to move the joints on her own. Also, sometimes it's difficult for relatives or loved ones to do exercise on their person. So a trained person will do the work well, especially to initiate it, get the joints moving, and then from there on, they can take over, and then the patient can take over themselves. But yes, it is possible for her to gain motion. Yeah, so it's important that she seeks medical attention. Yes. Yep.
All right. Moving on, there is this other one from Josephat. Says, in Nairobi, I have been having a very serious burning sensation which erupts into pain on my left hand, up from the elbow down to the hand, just the whole hand, and it starts at night. So what can I do to this, because it gives me worry? Let me take that again. I've been having a very serious burning sensation which erupts into pain on my left hand, up from the elbow down to the hand, just the whole hand, and it starts at night. So what can I do to this, because it gives me a lot of worry?
Okay. So just to help or just brainstorm about what's going on, it would be important to, like I said, it would be important to get a bit of more history, and then from there be able to know what's going on, but also have a look at the hand itself, because there are some things that could be causing that. Number one, if it's at night, it could be, you could be lying on that arm. There are some nerves that usually get across the joints, especially the elbow joint, okay? That nerve is usually prone to being compressed, which can lead to the burning sensation and pain. Also, it's important to ask some questions, because sometimes there are things that present that way. So it's important to ask questions like, are there any other diseases that the person might have, okay, that might cause that type of pain? Because you can have inflammation of nerves that can cause pain, and sometimes they usually present during the night when you're resting, when your body is not active. Okay. Then the other thing I would think of is there any history of trauma? Okay. If there was trauma, it could be maybe a piece of a bone, or during the healing process, the bone overgrew and now it's lying next to a nerve. Then we would be able to have a look at it, we'll do an X-ray, or is that pain coming from, because the nerves usually come out through the neck? Is it somewhere up here, or is it in the brain? Maybe a specific part of the nerve that is causing the pain. Is it something we need to worry about, or is it something that's going to go away on its own? So it would be nice to see an orthopedic surgeon, so that then we can investigate further and see how to help. Yes.
All right.
Yes.
Thank you for that. Let's look at this other question here. This listener is asking, the name is Monica. I have some form of arthritis. My knees are swollen and stiff, and I also have a Becker's cyst at the back of my knees. Can the fluid in my knees be drained? That's the question from Monica there.
All right. Okay. So that's a good question. So then for Monica, so during arthritis, so the knee contains what we call a capsule that prevents fluid from going into other tissues. Okay. When you start having arthritis, sometimes the fluid can escape and go into other compartments. Okay, then you can end up with things like a Becker's cyst. So number one we would want to be sure that it is a Becker's cyst before we can decide to do anything. But if the underlying cause then is osteoarthritis, then the first thing would be to start, because as I said, osteoarthritis is usually due to inflammation. Okay. Now, luckily, there are some medications that usually we call them non-inflammatory medication. Okay. So then we would start with those, okay, because they reduce the inflammation. This fluid is being produced by the knee. So we could then target the knee joint using the what you call NSAIDs, and then the fluid production would be reduced. Then these Becker's cysts could go away. If it doesn't go away, then I would think of surgical options. Okay, we would look at the knee as a whole and then see whether it is beneficial to just go for the cyst or just do something about the whole knee. Okay, yeah, but I think beginning with NSAIDs would be a good way to treat that. Okay, yes.
All right. Then there is this other question from Peter. Peter says, I had an accident 2 years, probably 2 years ago, and broke my collarbone and left thigh bone and had plates fitted. My back also was affected. I recovered, but my shoulder is always stiff and numb. My right leg, which didn't break, is numb from the knee to the toes. Very uncomfortable. What could be the problem?
Okay. Yeah. Now, let me start with the numbness from the knee downwards. So for that, for the numbness, that's usually most of the time coming from the nerves. All right. So my immediate thought would be something could have happened to the nerves during the injury or the whole process of care that could have damaged one or two of the nerves. Okay, there are some superficial nerves that give sensation to the body below it. Once they are injured, then the sensation that comes out of it becomes altered. Then you have something like a burning sensation. Okay, but before we quickly jump into saying that it's the nerves, it would also be important to see if there are any other things, because there are other things like diabetes, which can also cause similar findings, similar symptoms of numbness. The other thing is, if they're complaining of back pain, the other biggest culprit is usually nerve impingement around the back. Okay, it could have been injured during the accident, or it's a normal degenerative process that is ongoing. You could have a disc that is bulging and that is compressing one of the nerves. It usually occurs, and sometimes it's usually on one side. Some people like to call it sciatica. It could be sciatica or it could be something else. Okay. So once we would see such a patient and do a history and a physical exam, they could start with some medication, but that is after we have seen this patient. Okay, we see this patient and evaluate, then we could see what to do, because I've given an array of where it could be coming from, and all these have different ways of being treated. Okay, we go to the clavicle. So for the clavicle, if they're having stiffness in the shoulder, again, it could be because of the accident. It would be important to find out whether maybe there was a fracture that went into the shoulder joint, okay? Or because when we treat you for a fracture, we immobilize you for some time, okay? Then after that time, once the pain subsides, we want you to do physiotherapy so that you can regain your function. If physiotherapy had not been done, then you can have some stiffness, okay? So then we would want to do some imaging to see whether there's anything in that joint, okay? We need to visualize and see the joint itself. Then we are able to see whether there's a problem in that particular joint, okay? The other thing is, of course, just ask general questions, because there are other things that usually cause shoulder stiffness, okay? You could have some endocrine anomalies that can cause this. So it's important for you to be investigated as a whole. Then we can find the right treatment, okay? Yeah, or even it could be, we also need to look at whatever implant had been put and see how it was put. Yeah, and see whether it could be causing that stiffness. Yeah.
Right.
Yeah.
All right. Moving on, we have another question here from our listener who says, what about pain or feeling tired on my knee? Is it too much weight on that side? Once again, what about pain or feeling tired on my left knee? Is it too much weight on that side?
Yeah. Yeah, that's a good question. So it could be depending on the person.
Yes.
Like I'd said, obesity is a cause of knee stiffness and also arthritis. Okay, so it would be important to know when they are saying is it weight, to know what weight they are talking about. Okay, because it could be the weight, or it could be something else. If you are talking about somebody maybe in the early 20s and somebody in 60s, they're two different people. Okay, so we would think differently depending on this particular person. All right, but the weight could contribute to that pain. Yes. Yeah.
All right. And this one here says, my name is Abigail. I had my normal delivery 7 years ago, but since then, my pelvic bone on the thigh region, as I put my legs apart, I usually feel uncomfortable and mild pain. I can't do a 180 because I usually feel pain. What can I do to relieve the pain? This has also led to lower back pain. Yeah.
Okay. Yeah. So there's a lot that goes on around delivery. So there are some bones that usually have to expand for the baby to be born. And also during the pregnancy, the journey itself, the back is usually, it carries a lot of weight. Okay. Sometimes the curvature during the whole pregnancy period can be altered just due to the weight of the child. It is very common to have back pain, especially during pregnancy. So that could explain that. Also, because I have just said that there are bones that need to expand for the child to pass. All right. Sometimes, depending on the weight of the child, the expansion can be more than usual. All right. If that is not noticed, you could start having pain. So the pain in the hip could be from that, or it could be independent. All right. So those are the things that we would think about. Now, from there, we would need to look at these 2 bones, or the 3 bones. We need to look at the back, okay? And then we need to look at the pelvic bones that usually expand during delivery. And we'll also need to look at the hip joint, okay? For the back, usually we encourage mothers to undergo physiotherapy, especially after birth, because of the back pain. Because sometimes it can go for quite a long period of time. Okay. Then, so what we would do is, after the history and the physical exam, asking many questions, then we would go into looking at these bones by doing an X-ray, just to see the bones, how they look like, so that we are not missing anything. Then now, once we find that, then we'll be able to give a good care or plan of treatment for this particular, for Abigail. So I would urge her at least to be seen, so that she can get the right thing done. Yes.
Right. More questions coming, and so we'll just head to them. Here is Lucy. Lucy says, I have benefited. What am I not supposed to do if I'm having the joint pain? Can I continue alighting and helping kids cross the road? More than 30 kids in a school bus. Let me get that again. I have benefited. What am I not supposed to do if I'm having the joint pain? Can I continue alighting and helping kids across the kids cross the road? More than 30 kids in a school bus.
Yeah, 30 kids. Sounds like a big number.
Yes.
I wouldn't say much about the number, but I would talk about the pain that she's having. Number one, if I'm getting the question right, is that she's having pain because of the kind of work she's doing. Is that right?
I think so.
Yeah.
Yeah.
So what she would need to do. So there's something we call genomics, how to do things. Okay, like how you sit, how you lift objects. Okay, if you're lifting an object, you need to go close to it. All right, and then when you're lifting it, your back should be straight. Okay, so that you're not stretching the lower back. You're not straining the lower back. All right. If you're sitting, at least the shoulders, the back, and the pelvis should be in a straight line. Okay, so that you're not stressing the back. So those are called genomics. So then it would be important for her to see a physiotherapist, so that we can know the type of activity she does, and then advise on the right way of doing things. Okay, because you find you might be doing things the wrong way and straining a particular joint, then you end up with osteoarthritis. Okay, or you just hurt that joint and you're not able to work in that particular field for a long time, or you end up being unhappy. So it would be nice to know how to work in the right way. So those will be genomics around what she would be doing. Yes. Yeah.
Right. This one here is asking a question. Let me check that again on Facebook, saying, asking, is knee pain arthritis? Asking if when going for a long call or a short call, that very action of squatting is a problem. And so they're asking, is knee pain arthritis?
All right. Okay. So knee pain is not necessarily arthritis. It could be anything else. It could be just maybe they're not used to that type of activity. And now they are doing it maybe more often, and now the knee is complaining. Depending on the age and the activity, it could be arthritis. Inside the knee joint, there are some ligaments. Okay, there are some ligaments that, especially if you are somebody who used to do sports, that could tear either partially or wholly. You also have things like meniscus that could be injured, and those usually they usually work during that when you're getting up from squatting. So then, or it could also be the patella, because the patella could also be affected in the knee. Okay, so then for that also, that now would need, after we look at the joint, do an exam, we would need something like an MRI to be able to look at inside the joint and see, and just make sure nothing is wrong with that joint. Yes, but it would be nice to know how long this has been, how severe is it? Is it preventing this particular person from carrying out their normal activities, or is it something that you just had once and then it's gone? Is it, such questions would guide us to be able to know what to do.
Right. I see another question here from our listener, and she says, didn't tell us, saying, my mom has 2 hip joints replacements as a result of arthritis. Recently, she started complaining of pain on her left knee. It was confirmed that it has also been affected by arthritis too. How can we go about it?
Look, she said it's confirmed arthritis, right? So if it is confirmed arthritis, we would need to know the degree of arthritis. Now, there are things that we look at when we talk about arthritis. We look at the joint space, because I'd say there's something called cartilage. Now, the cartilage is what lines the joint. We need to know how much of it is left, okay? Because we are now thinking about either surgical or non-surgical management. We always want to begin with non-surgical management. So we look at the cartilage, we look at the joint space, how much of that cartilage is left, okay? We also, during arthritis, when the cartilage is worn out, the bone produces more bone, which we call osteophytes, okay? So those pieces of bone, they reduce the space in the joint, okay? And they may lead to pain. So the other thing we would look at is if there's noises in the joint, okay? Now, when you look at all those factors and listen to the patient's story, how the pain is affecting them, then we'll be able to know, do we want to go surgical or non-surgical? One of the things in non-surgical management would be physiotherapy. Okay, what physiotherapy does is it strengthens the muscles around the joint, right? So your bones and your joint is not carrying the whole body. The muscles around the joint are helping the body. The joint carry the body. So you strengthen those muscles. There are those muscles on the front and the muscles at the back. So you strengthen those muscles and they're able to help the joint work properly. Okay, that's the physiotherapy. And also just moving the joint. Number 2, we would start with the non-inflammatory medications, okay? They reduce the inflammation that is going on in the joint, right? So this reduces the wear and tear, okay? Now, once we've done that, we look at maybe the weight. We talk about things like diet, okay? We reduce the weight, we improve our diet for some time and see how she's going to do, right? She gives us feedback. If she's feeling better, then we can continue with the non-operative management. But if we look at, if we maybe look at the X-ray, we see it's very severe, and she also says she can't work with it. We try the non-operative ways and they're not working. Then we can think about changing the joint. So she would have now 3 joints that have been changed. Okay. There are other things that are being tried, which are still being studied. Like we would take some, we call it platelet-rich plasma, and inject into the joint and see whether it's going to improve. All right. So what that does is basically to reduce the inflammation in the joint, but that is still being studied. Okay. Yes. So that is how I would go around it. Yeah.
Thank you. Thank you for that. Let's look at another question. This one is from Michael. Michael says, what's the cause of fingers paining along the joints and the wrist? What's the cause of fingers paining aching or paining along the joints and at the wrist? This is from Michael.
All right. Okay. So my number one question would be, what does Michael do? Because if he works a lot with his fingers and wrists, that could cause the pain, maybe due to excessive use. But also, it's important to know how long it has been there, what makes it better, what time it is. Like we had said, things like rheumatoid arthritis, you'd have pain in the morning. If it is trauma, you'd have pain in the evening. When you're less active, there are things also like gout, which could be due to high uric acid. Okay, so those are the things that we would need to think about before we pinpoint and say this is causing your pain. So those are the questions I would ask, and then move on from there to see how to help. But the occupation also usually matters a lot in terms of what you do. If you're doing repetitive motions to a particular joint, that joint might ache after some time because of wear and tear. Yes. Yep.
This one here is asking, how do you treat a heel spa? How do you treat a heel spa?
Okay, a heel spa. All right. So a heel spa, so there's a tendon. There's a tendon called an Achilles tendon. I don't know how to explain it in simple terms, but it runs at the back of your leg. Okay, from the calf. It goes from the calf as a muscle, and then it goes down all the way to your heel. All right. So where it attaches on your bone, that bone around that place is called the calcaneus. So when it attaches, that point between the tendon and the bone sometimes can get something called inflammation. Okay, so when you have inflammation that is repetitive between the bone and the tendon interface, then the body produces, then you start forming a bone because of that repetitive inflammation. All right, so it's almost the same thing. So initially, we would, if the pain is too much, we would immobilize you and give you, by immobilize, I mean we would stop you from using that foot for a short period of time, put you in a boot or put you in a plaster, then give you some NSAIDs to reduce that inflammation, especially in the early stages. Okay, but if it is in the late stages, then we might need to go surgically and remove that part of the bone that has become bony. All right, and then reattach the tendon elsewhere. Yes, so that's what we would do. There are various ligaments around that calcaneus that can present in the same manner. Okay, yes, so I think that's how we would roughly go about it if it is a heel spa. Yes. Yep.
Learning a lot. Probably this is the first time I ever made that word, heel spa. So tonight I got the answer. Let's look at this one here saying, is there a connection between backache and arthritis?
Yes. To go direct to it, yes, there is. Backache sometimes can be due to arthritis. It can be due to spasm, muscle spasms. It can cause backache. But yes, backache can be caused by arthritis. Remember, in the back, especially the lower back, okay, there's a lot of motion that goes on in the lower back. And that is why most people complain of low back pain. You could still have pain in the neck region because the neck is also quite mobile. So the joints that are mobile will experience more pain and stiffness compared to the joints that are less mobile. So because of the motions around the low back, and maybe what you do, maybe you sit a lot, you're a driver, you're a doctor, you're a teacher, and maybe your ergonomics have not been okay, or sometimes even if they're okay, you can still have, because of the motions and the stress on the joints, you can still have arthritis. So it could be arthritis. The only way to find out, so for such a patient, if it is the first time presenting, it's not the worst pain of their life, maybe it's just a dull pain, we could start with physiotherapy, and then we do some NSAIDs and see how it does. Then if that doesn't work, we could still do an X-ray, look at the back and see whether the joint space is reduced. Then from there, we could move on to something like an MRI and see. Now, the MRI will tell us very well what's going on with the joint, all right? Or a CT scan for the bones. But if you think it's the nerves that are being compressed, we could do an MRI and be able to see. And then we'd be able to help the particular person well. Yes.
This one is asking, what causes tingling of fingers and numbness of feet? Tingling of fingers and numbness of feet, and what can one do about it?
All right. So again, that goes, it follows the same trajectory as the other one, because the tingling, number one, I would classify them into maybe local factors, which could be the nerves or something systemic from the brain. If it is local factors, it could be compression of the nerves from where they're coming out, from the spinal cord, because they move the cord. It comes out from around the skull, and it goes on your back. There's a way they come out. Now, where they come out, they could be compressed, either by the discs or irritation by the bones around them, or like we had talked about the elbow, where the nerves pass through, when they pass through the elbow, or anywhere along where the nerves pass, they could be compressed. And that could lead to the tingling sensation. For the back, for the legs, it's almost the same. Something called sciatica, which people talk about a lot. It could be that the nerves also that are exiting around the back, sending sensation to the legs, they could be compressed. Now, once they are compressed, they'll give a false feeling that is not usually the correct feeling, which is tingling or numbness. Yes, because it is being compressed. Yes.
And I think this listener who asked this other question has something probably to do with what we've just mentioned, but I'll just go about it and then ask in light of the part B of the question, saying, my name is Wamboi. Every night I have a tingling, burning sensation on my soles, the sole of my feet and palms, which lasts for about 5 minutes. Then it goes. Could it be a menopausal effect, or nerve problem? During the day, I'm just fine. Yes.
Okay.
Yes.
Yeah. It could be a nerve problem, or it could be, depending on age, it could also be a menopausal problem, especially maybe in the hands. Sometimes hormonal changes can affect the way nerves function or the way we perceive pain. So that would need a collaboration between the orthopedic surgeon. We would evaluate her and see. And then if need be, then maybe we would involve a gynecologist to see if there's any correlation between the two. Yeah. So that would be multidisciplinary. Yes.
Right.
Yeah.
Another one here is asking, kindly help. I have a 1-month-old and there is pain at the back, which makes it hard while sitting. I hope they're referring to themselves. I have a 1-month-old and there is a pain at the back, which makes it hard while sitting. And my left leg, there was much weight. It's sciatic, I believe that's what the listener has written here. So they need help. They need help regarding the pain at the back and makes it hard while sitting. And the left leg, there was much weight. It's sciatic. That's what she has mentioned.
That's a valid question. So like we had said, during pregnancy, the women go through a lot, and almost all organs are usually affected. One of them is the back because of the weight it has to bear. Okay. And the posture that you have to assume during the pregnancy. I think that there are changes also on how they're supposed to sleep, which is uncomfortable for them. But low back pain sometimes can be caused by pregnancy. Now, for her, it would be nice to have her checked, so that we can start with something like physiotherapy, right? Because physiotherapy goes a long way. It is something that you start with, and once you get a home exercise program, it's something that you can use for the rest of your life, because it's going to help you. But I think because it's 1 year post-delivery, it could be pregnancy related, or also the child, because there are a lot of activities that are involved, especially during breastfeeding, the posture itself, because even in breastfeeding, you need to be taught how to place the baby, not just for the baby, but also for the comfort of your back. You see, so those are some of the things that we would need to talk about and ask and see how she's been doing them, and then be able to help from there. Yes.
Right. I think we'll now just have a bit of what you'd call a summary of what we have been looking at tonight, because there are many, many questions. God willing, next time we'll look at them, the other questions as they come. A summary of joint stiffness, and then we will conclude.
All right. So joint stiffness is reduced motion across a joint. This will be person dependent, because every person may have a different range of motion. You could compare it from before and now, and then you could say it is joint stiffness. There are various causes of joint stiffness, which could be global or local, and we've talked about them, such as trauma and autoimmune diseases. You need to seek healthcare if the joint stiffness is persisting, if it is caused by pain, if it is accompanied by things like fever, or swelling or redness along that joint. So once you get to your physician, they'll be able to have a look at you, and then be able to give you a diagnosis and give you the appropriate care. But most of all, it is important for the joints to move. You need to exercise and you need to keep moving. So that would be the message I would give is we need to keep moving. We need to look at our diet and eat healthy. We need a lot of vitamins so that we can give the body the antioxidants. All right. Then we need to have the right amount of weight. We need to lose weight so that our joints are kept healthy. And physiotherapy, which is quite important. Yes.
Dr. Jeremiah, one thing I would like also to give you an opportunity to share about what you've been up to at QA International, probably something that the listener would want to know, and then go ahead and let them know in case somebody would want to get in touch with QA International, how they can go about it.
All right. So QA International is located in Kijabe, in Lari, Kiambu County. We deal with orthopedic issues for children, all children, from birth to around 18 years. Depending on the case, we could go up above 18 years. So we mostly see patients with things like clubfoot. If you have bow legs, knock knees, we are able to see you. So we encourage you to bring your kids. We also see children who have cleft lip and cleft palate, burns. Once you have burns and they're healing and you have contractures, you're not able to move the joints, like you have stiffness, like we talked about, we have plastic surgeons who are also able to help and treat you accordingly. So I'd encourage you to bring your kids. Our clinics usually mostly on Wednesday and on Friday. We have a spine clinic on Friday that sees patients with scoliosis and other spine-related deformities. The other days you'll also be seen and taken good care of. So I urge all parents to bring their kids, or if you know any other child who has any bony deformity, we are very happy to assist you. Yes.
Great insights there, Dr. Thank you so much for coming and sharing your insights regarding, the health of our bones.
Thank you for having me.
You're welcome.
Thank you to the listeners. God bless you.
Amen. Right. Well, that's just about it on the Medical Moment tonight. We hosted Dr. Jeremiah Nangale from AIC International, an orthopedic surgeon who serves there. In the next hour, we have from the scriptures as well as reflections, not forgetting prayer focus right here on Breath of Heaven. Stay tuned.
Hi, this is Carol from